Let us continue with the video. We were talking about why irrigation or irrigating is important during a dental surgery. Why? Because when bone is cut, copious amounts of irrigation should be used to decrease the amount of bone damaged from heat. Soft tissues should also be protected from frictional heat or the direct trauma from drilling equipment, because the risk of infection rises with the increased size of an inoculum. One way to lessen the chance of wound infection is to decrease the bacterial count, and that is through irrigating. This is easily accomplished, again, by repeatedly irrigating the site during surgery and closure. Irrigation also dislodges the bacteria and other foreign materials and rinses them out of the wound. Okay, for tooth sectioning, let me again show you the picture. That is a picture for the removal of the bone that we are going to make. The red mark there is the area where we are going to drill, and the next picture is, so the black portion here is, let us put into action that, or say that the bone is already removed, and the second thing that we're going to do is to section the crown. So that's the red line there. The red line represents the sectioning of the crown. And the third one is to elevate the distal root here. Oh my. So the third thing that we are going to do is to elevate the distal root here. So let us put also in that the crown is already removed, so the next thing is to elevate the distal root. Now it is very important to separate the distal root from the mesial root, because if you proceeded in extracting the two roots at the same time, the distal and the mesial roots at the same time, there is a high risk of fracture, and it will be very difficult. That is why we are going to separate them first before removing them one by one. Okay, and here is a picture. Provided that there is already bone removal, the crown is removed and the distal portion is removed, and the red line there represents the mesial root remaining that is to be elevated. Okay, and so provided that we successfully extracted the impacted tooth, now we are going to debride the wound, the debridement of the wound. Okay, so using a periapical curette, the socket is thoroughly debrided. The sharp bony margins are smoothened using a wronger or a bone file. The socket is thoroughly irrigated with oral betadine with saline solution, and you should control the bleeding first before suturing. For the closing and suturing, using a black silk, the surgical, the surgical silk or the thread is soaked before in oral betadine, and suturing needle. Initial wound closure is achieved by placing first suture just distal to the second molar, and the sufficient number of sutures is done to get a proper closure. Sutures should not be excessively tight, and the patient is then made to keep firm pressure on the gauze padding placed in the mouth. Now, suturing of the surgical wound is necessary, aiming at holding a flap over the wound, reapproximating the wound edges, protecting the underlying tissues from infection or other irritating factors, and to prevent post-operative hemorrhage. We should also remember that the knot should always be to the side and never on the incision itself. This makes tightening easier. This irritates the wound less and facilitates cutting and removing the suture. And after all of that things, Now, let us give the patient the post-operative care and medication after the surgery. Post-operative instructions should predict what the patient is going to likely experience, explain why this phenomenon occur, and tell the patient how to manage and control the typical post-operative sequelae. The instructions should be given to the patient verbally and on written sheet, and the instruction sheet should describe the typical problems and their management. So after the surgery, the patient should drink Celecoxib Celebrex 200 milligram capsule after surgery, before the anesthetic effect of local anesthesia wears off. Avoid gargling, smoking, spitting, drinking with straw, since this can dislodge the newly formed blood clot. Now, the process of spitting as well as drinking using a straw involves a negative pressure and mechanical agitation of the extraction, which may prolong the bleeding. The negative pressure created by smoking and using the straw is this suction the mouth may promote bleeding and should be discouraged. So no spitting, drinking with straw, smoking allowed after the surgery, or even before a few days after the surgery. Okay, pressure pack must be placed after the surgery for 1 hour. Do not change them unless the bleeding is not being controlled, and if active bleeding persists 1 hour after, place enough gauze to obtain pressure over the surgical site for another 30 to 60 minutes. So the control of bleeding is very important before, during, and after the surgery. Okay? And a cold ice pack or ice bag wrapped in a towel and applied firmly to face or cheek adjacent to the surgical area. And also the patient should have soft diet for a few days, approximately 2 days, and resume taking co-amoxiclav augmentin 625 milligrams per tablet twice a day for 1 week. Keeping your mouth clean after surgery is also very essential. Be mindful in brushing your teeth, especially near the extraction site, and careful not to brush that hard. Okay, and avoid strenuous activities for the next 48 hours. No, strenuous activities or exercise should not be performed for the next 12 to 24 hours after extraction, because this increase the circulation that may result in bleeding. And after 1 week from the surgery, we are going to see again the patient. Suture removal is done on the 7th day. Most significant pain should be resolved, although local discomfort may persist for 2 to 3 weeks. Swelling should resolve 7 to 10 days after the surgery. Facial bruising may persist up to 10 to 14 days. Local heat, a heating pad set on low, or hot water bottle will help things return to normal quickly. Jaw stiffness is normal and should be expected following the surgery with all the mouth opening the patient did during the surgery. It's also hard on the part of the patient. You must make a conscious effort several times a day to stretch your jaws wide open. Chewing gum also helps to exercise your jaw. By a week after the surgery, you should be back to brushing your teeth as normal, hopefully several times a day. And there is no need for excessive use of mouthwash. Extra attention at the extraction site may be necessary for up to 3 to 4 weeks. And after the teeth are removed, until tissue healing has filled the defect. And approximately 1 week after surgery, your diet should be returning to normal, and you may require And I think that's all. Thank you so much for listening. Again, I'm Riza Tilacamra, a fourth year dental student of Misamis University. I will see you again soon. Bye.